COVID hospitalizations are rising across the country as the U.S. battles the Delta variant. The country is now on pace to potentially surpass peak hospitalizations. But according to ABC News analysis, in the week since the Pfizer shot received full FDA approval, the number of people getting their first shot each day is up 17%. Ariel Reshef has the latest. Hi, Ariel.
Good morning to you, Diane. Here's what has health experts so concerned. More than 101,000 people are hospitalized with COVID-19 right now across this country. That puts us on pace to meet or surpass our January peak of 125,000 people hospitalized with COVID at one time. And also alarming, 300 children are now being admitted to the hospital every day with this virus. And as the hospitalizations increase, so is the death toll. 900 Americans losing their lives every day to this virus. That's up 370% over the past 7 weeks. But there is some good news on the vaccine front. 470,000 people have gotten their first shot every day since the FDA fully authorized the Pfizer vaccine 1 week ago. That's up 17% from the week prior. Diane.
All right, Ariel Reshef, thank you. And I want to bring in infectious disease specialist at South Shore Health and ABC News contributor Dr. Simone Wilds for more on all this. Dr. Wilds, thanks as always for being here. I'm curious, what do you think when you look at these numbers? Do you think we'll actually surpass peak hospitalizations that we saw last January?
Diane, I think based on the current trends, I think we're heading in that direction. Really, it's very concerning, the number of cases we've been seeing lately. I think that we really have to try to do everything we can to avoid that and get everyone vaccinated.
Now, Pfizer just announced they're in phase 2 of a study on new oral treatment for adults with low risk of severe disease. What does that mean for the general public? And what do you think we need to know about this new treatment?
Diane, I'm really excited that we have an oral option for individuals right now. Most of the treatment options are IV, and it can be very difficult to administer. I think people that have mild illnesses can be managed at home. And so moving forward, definitely more tools that we can utilize, which will make things better for everyone.
And free up some of those hospital beds, no doubt. Virginia Tech also announced yesterday that it disenrolled more than 130 students who did not meet vaccine requirements. So do you think we will see this happen at more schools? And as a medical professional, do you think it's necessary to mandate vaccines on college campuses?
Well, I think what we're seeing at Virginia Tech is something that we're going to see not only at other schools, but in workplaces. I think the key is that we're trying to keep everyone safe and to prevent outbreaks. So I think going forward, we'll absolutely see more vaccine mandates in schools.
It also looks like, good news here that there's an uptick in Pfizer shots in that week since the shot obtained full FDA approval. So do you think that those numbers will keep rising? That's just a week after the approval. Do you think that will boost some confidence in people who were vaccine hesitant until this point?
Well, the good news is it has boost. The key is whether we're going to be able to maintain it. I'm hoping that we can. We're trying to get the word out to encourage everyone to get vaccinated now that we have full approval. So we definitely want to see that trend in that manner.
And we're also now hearing that 300 children are now admitted to the hospital with COVID each day. School is starting across the country. If it hasn't already, it'll be starting in the next couple weeks or so. So what are you most concerned about there? What do you think parents and administrators need to keep in mind, particularly since kids under 12 still aren't eligible for the vaccine?
Well, the key thing I want to stress is we want to get our children back in schools, and we want to make sure that they're healthy and well. And there are a number of things we need to do. Make sure that the children are wearing their mask. Make sure they're washing their hands. And for the schools, we want to make sure that there's testing available to them and good ventilation. Let's try to keep our students and staff healthy as they go back to school this year.
And Dr. Wilds, I'm about to send my own kid to school for the first time. Not nervous about that at all. But, obviously a lot of I have to rely on the school and trust the school in so many ways when it comes to this. But as a parent, are there any things that you recommend that we parents can do at home to try to keep, the whole ecosystem safer?
Diane, I'm in the same position. I have children going back to school, so I can totally relate. What I tell my children is wear your mask, make sure you wash your hands, and work with your teachers and all the staff. And as a parent, I'll encourage all the parents, if they have not been vaccinated, to get vaccinated, because that will help to protect everyone. And if your child is sick, please keep your child home that day so we don't get everyone else at school sick.
All right, good advice. Dr. Simone Wilds, always great to have you. And good luck as you send your little ones to school as well.
Thank you. You too.